organ, SBM Intelligence, says the Independent National Electoral Commission, INEC, did not do enough to support persons with disabilities, that's the PWDs, during the 2023 elections. It says that only 22.26% of PWDs had assistive aids, while 38.05% could not access voter education initiatives, the report stated. Post-election matters often does not include persons living with disabilities. This can be seen in infrastructural processes, policy and decision-making, calls to action by the federal government, which barely has much inclusion.
Now, most times when discussions around the poor state of the nation's economy is discussed, persons living with mental and physical disabilities are almost never a talking point. These citizens continue to struggle with getting by each day, managing societal definition of who and what they are and who and what they should stand for. This morning, our first guest will be joining us to look at ways you and other members of the society can be there for persons with disabilities. Our guest is David Temitokpe Uludai. He is an applied psychologist and executive director of Lifeline and Milestone Inclusive Consulting, specializing in transformative solutions for individuals with neurodevelopmental disorders, physical disabilities, and mental health support needs. That was a lot. Good morning.
Morning.
Thanks for joining us. It's 2024, you know, and it's maybe still heartbreaking that we still are having discussions about how poorly Nigeria recognizes persons with disabilities and how little provision is made for these ones. Over time, it's been a recurring conversation, maybe once or twice every year. But where do you think we are at this point?
I would start by saying that first of all, thank you for having me. All right, I will start by saying that we would not say there is no progress being made.
Yeah.
All right, because in 2018, there is signing into the law, the Prohibition Act for the discrimination against people with disability. So that's a progress. And look at, since our independence till now, 2018 is just, yesterday.
Yeah.
It means people with disability have, been set aside in their quest to be involved in, the community, in governance, and also in their areas of, desire to fulfill their potentials despite their disability. So, and also, Lagos State government has also done something. Just January, there is an appointment of a new general manager for the Department for People with Disability in Lagos State, Lasoda, and having a conversation with her recently, she told me of her plans and all, and basically the president of the nation, President Tinubu, actually also, made a promise to people living with disability earlier this year, and also last year through the Minister for Humanitarian Affairs in the nation. These are just promises, but obviously looking at the present statistics of, the people living with disability and how they have been recognized in our society,
yeah,
you will know that we are very much backward. And to add to this is the fact that you would discover that presently in the nation, and particularly in Lagos State, we do not have specific data of the people
yes,
living with disability. And if you don't have their data, it means you can't reach out to them. It means you do not have a plan for them. And so presently, this is like the state of the nation as has to do with people living with disability.
All right. Let's talk about the people that fall into the category of people living with disability. Oftentimes, when we hear people living with disability, we look at the physical, those who have some form of physical challenges. We don't talk a lot about those who have mental disabilities. So give us a picture of what constitutes people living with mental disabilities.
All right. When we talk about mental health, basically, we are talking about three basic things: your emotional well-being, social well-being, and your psychological well-being. And that means we are talking about how you are able to feel, to think, and also behave.
Yep.
And of course, you know, this imparts our daily function. All right, so when we talk about physical disability, obviously we see people with physical disability, we can recognize them. However, there are a lot of disability that is called invisible disability. Although there are neurodevelopmental disabilities that are actually, you know, based in brain dysfunction and can actually result into physical disability. But not all neurodevelopmental disability, for example, is visible. All right, like somebody with ADHD, all right, somebody with OCD and other diagnoses, you would discover that these are invisible. And so lack of diagnosis or also limited or misdiagnosis is what we see these days, and it is a concern that we need to really look into, because people living with disability experience a lot of mental health challenges because they do not have access to, you know, healthcare generally,
Right.
and also mental healthcare facilities.
Now, I'll come back to the physical. I want to talk about the mental a little more.
Okay.
Challenges, the average Nigerian has gone through a really tumultuous time. It's been very turbulent, trying to make ends meet. And even those who did not think they had mental health challenges now feel like they are dealing with some form of anxiety and depression because people just don't know what next. We're dealing with inflation, we're dealing with high cost of living. So it's just a lot of factors that would affect the average person who naturally doesn't have any form of mental disability. So now talking about those who already have mental disabilities, like you've mentioned, in this time, is there any form of support available to them, you know, and how, what exactly does pressure in this time look like for those who have mental challenges? After that, we'll come to those living with the physical challenges.
To talk about mental health challenges and the provision made available for them, first of all, when we look at the statistics, you see, it is, we have 1 in 4 Nigeria presently, according to World Health Organization, says 1 in 4 person has a mental health challenges, okay? And if you look at that, you look at situations surrounding this, such as the economy, and other factors which you have mentioned, you'll find out that the challenge they have presently is the fact that they don't have access. Then most of them who actually know that they are actually battling with, you know, one mental health challenges or the other, they actually face discrimination. An average Nigerian who knows that he's facing mental health challenge does not want to seek help. What they do is to mask because of discrimination.
Right.
You know, what would people say about me if they find out that I am battling with this or that? So because of discrimination, a lot of people would rather, you know, lean on masking than, you know, seeking help from professionals. And what about the professionals? Do we have enough professionals who are trained to handle the issue of mental health challenges among Nigerians? The statistic also shows that the professionals available presently is, you know, 1 to 100 Nigeria.
Yeah.
And that's not enough. A lot of our mental health facilities do not make provision for mental health care, except for the neuropsychiatric hospitals that we have, very few in Nigeria. And these are organizations and institutions attending to people They're having severe mental health challenges. But you don't have to, for example, be mentally retarded to get help. You know, cases like anxiety, you need a professional intervention. But you do not just get access to them, not because the few are not there, but because there are a lot of people to be attended to, as against the number of professionals that are trained, certified, and given opportunity to practice.
Yeah.
Yeah.
Tell us about what a, I think we've already established that we already have challenges as a country, but what would a society, what would a society that truly recognizes these persons and makes provisions for them, what would that society be like? What are the things that you would say to the Lagos State government, for example, that you must put in place if you truly want to recognize these ones and make provisions for them?
You know, someone once said that the true measure of a society is how they treat the vulnerable among them.
Yeah.
And so, in that regard, we would say that presently, the society needs to understand three basic things. Number one is inclusion.
Yeah.
And when we talk about inclusion, it's not just, okay, just join us, we are here. We also talk about, you know, accessibility. A lot of them are potential. We need to understand that disability does not, you know, describe anyone. And we need to begin to educate and create awareness that people should understand that people are not limited by their disability. All right? And we need to also ensure that we, apart from inclusion, apart from accessibility, advocacy is very, very important too.
Yeah.
We all need to understand that, first of all, the society needs to understand that everyone is, first of all, human before you talk about their disability or abilities. So we need to begin to think from that perspective in order for us to, you know, be able to provide proper accommodation for people living with disability.
Okay, you talked about the promises. You talked about having a conversation with the manager of La Soda. You talked about, you know, the president and the promises. Do you feel very positive about the plans that are being made for people living with disabilities in Lagos?
Yeah, we can only hope. We've had a lot of conferences, we had conversation, and you know, we also hope for collaborations and partnership with you know, government agencies concerning this. We would not say that at the moment that we are so proud. You know, on the news just last year, 4 people were empowered by the federal government. Among how many people living with disability?
Yeah.
So is nothing to be proud about. So we also need to call on the government to look into this. It's not enough to make policies. Much more, there is need for the government to also, you know, send out task force to ensure compliance with these policies. So it's not about, you know, making policies and expecting that the policies will be implemented just like that. So there's need for strategies for implementation. Thank you.
Yeah, I mean, I like that you mentioned that you've had a lot of conferences, you know, which is true. You know, every now and then we have these discussions. We celebrate, you know, international days, you know, United Nations days for, you know, this and that, but you know, the challenge really is action, you know, and we don't get to see that there's a lot of action and steps being taken in that, you know, regard. The Lagos State government will make its, you know, its promises. The Nigerian government will make its promises, you know, but there still obviously needs to be a whole lot more that is done with regards to inclusion and, of course, you know, making provisions to recognize these ones in society, and also just generally changing the mindset that people have, you know, concerning persons with disabilities. But baby steps, I guess. Thank you very much for...
Thank you very much.
For stopping by, and of course, you know, we look forward to having a discussion sometime in the future that, of course, states that we've made progress.
Thank you very much.
Thank you.
Thank you.
All right, we of course continue conversations this morning here on Breakfast Central. In its recently completed and eagerly expected investigation into the bombing of innocent civilians in Tudumbiri village, Igabi